My name is Dr. John Ngigi. I'm a nephrologist. I'm a chief medical specialist, and I've been practicing nephrology for the last 15 years. And as you are aware, today is the World Kidney Day, the 13th of March. This is a day that has been happening since 2006 and happens on the second Thursday of every March every year. It's a day that the world sits back and takes stock of what has happened in the kidney space, but importantly, a day that the World Health Organization has put aside so that we can talk about the ways to prevent kidney disease, raise awareness so that we can prevent persons from getting kidney disease, but even for those who have gotten kidney disease, how to manage them early. Today's theme is very simple. Are your kidneys okay? And we seek to look out at those people who can be diagnosed to have kidney early so that we can manage their kidney disease. The burden of kidney disease is widening, as we know, particularly because of the way diabetes and hypertension have come up. Over 850 million people worldwide are known now to have chronic kidney disease. And what is important about this statistic is that in the low economic economies like Kenya and other countries of the world, the burden is disproportionate, which means that there are more people disproportionately who have got chronic kidney disease in poorer economies. And this creates a very big burden. So for people to come together and try to prevent these diseases of kidney is very, very important. Now, we are also saying during the World Kidney Day that we must identify the people at risk, because those people at risk are the ones who are likely to get chronic kidney disease. Now, in higher economies or rich countries, everyone can be screened. But for us in this part of the world, we are looking at people at risk and we screen them so that we can identify those people who have got chronic kidney disease. And who are these people at risk? We are looking at people who are diabetics, people who are hypertensive, people who are obese, people in whom there's a family history of chronic kidney disease, people who have got congenital problems, like particularly in children, people with obstructive problems, people with recurrent stones, people who have been taking a lot of non-steroidal anti-inflammatory drugs for whatever reason. These persons are at risk of getting chronic kidney disease and they must be screened. Why must they be screened? So that once we identify that they have got chronic kidney disease, then we can treat them early and prevent this disease from progressing so that they don't come to dialysis. Now, when it comes to dialysis, we are looking at the treatment of chronic kidney disease. A good proportion of people, when not properly treated, will progress on to what we call end-stage kidney disease. And in end-stage kidney disease, it means that you require some form of therapy for you to be alive or you to live. And there are two main ways of treating people who have got end-stage kidney disease. One of them is dialysis, and the other one is kidney transplantation. The burden of disease from chronic kidney disease finally spews up to treatment. And when we look at people who are now dialyzing, we have now, for example, in this country, over 2,000 people are now on dialysis. Dialysis is very expensive, and we must get an exit from this dialysis because the country cannot afford to treat everyone on dialysis. And I'm happy that SHA now has come up for people on dialysis because SHA is now paying for 2 sessions of dialysis. This is phenomenal because in most parts of Africa and third world economies, it's not affordable. Governments cannot afford. So at least for this one, we can applaud SHA because at least our patients are getting dialysis from SHA. At least 2 sessions is good enough, but for those who require 3 sessions, occasionally we have to ask SHA to motivate to get a 3rd session. Now, not everyone can be dialyzed, and we encourage those people who can be transplanted to be transplanted. So the next way of treating persons who have got end-stage kidney disease, particularly those who are amenable for transplantation, is offering them kidney transplantation. Now, I'm happy to note that this country has leaped far from other countries in Africa and sub-Saharan Africa, because now we are proud to say that we have our transplant programs within the country have taken up. Over 3,000 people have been transplanted in this country. Like, for example, there are several units or several centers in this country now that are able to offer kidney transplantation successfully and compete with other countries of the world. Now, new centers are coming up, and we are happy to notice this. Now, the big challenge that we have been having in kidney transplantation space is lack of donors. There are many people who would want to be transplanted, but they don't have donors. And that's why we are again talking to the KBPTS or the organization or the ministry, so that we can have the bill passed that persons who are not related, for example, can now be able to donate, and also we can be able to enter into the disease donation space. If we do this, then it will be an innovative ways of trying to get people to donate their organs. Another challenge that we have been getting in transplantation is affordability, particularly of post-transplantation medication. And again, this is another space that SHA has come now to our patients, because now, for the first time, SHA has now started paying for post-transplantation medication, which is a nice thing. Again, coming now to the transplantation itself, SHA is paying a substantial amount of money, so that the out-of-pocket expenditure has been reduced for many people who want to be transplanted. So these are milestones that cannot be forgotten when we talk about management of chronic kidney disease, particularly on this World Kidney Day. Now, many people have asked about donors, complications of donors and all that, but we are saying that people who transplant, people who donate kidneys are very well screened people. Make sure that they don't have any problems that can bring complications later. They are not diabetics, they are not hypertensive, so that their risks themselves of getting chronic kidney disease in the future are reduced to a minimum. Once they donate, many of them can get back to their normal lifestyle without pain, without medication. And if it's for ladies, they can become mothers and can get children as such. So basically, we are happy today to have joined the rest of the world in celebrating the World Kidney Day. We are also happy to observe the miles we have gained as a country and as a society. And again, it's exciting to be here. Asanteni.
Thank you.